Welcome back. People on Medicare will be able to negotiate for lower prices on a list of 10 drugs, including diabetes and stroke medication and a cancer drug. Now, the federal government announced that last week. It's a move pushed by Wisconsin Democratic Senator Tammy Baldwin. She spoke to political reporter Will Kenneally this week to explain what this means for people on those medications.
Medicare is announcing that it is able to now negotiate for the price of 10 different drugs. And kind of curious to get a sense of how new is this, that Medicare can now negotiate the price for some of these prescription drugs?
You know, for years, Medicare had been banned from negotiating with the big pharmaceutical companies for lower prices. And I was fighting for a long time to give them the right to do this, to bring down prices. We have way too many folks who have to choose between paying the rent, food on the table, or being able to afford their life-saving prescription medications. And it should not be that way. In Wisconsin alone, I think 20% of seniors on Medicare have reported that they've put off or rationed medication because of the cost. And that should not be the way it is. So now they have just announced the first 10 medications that Medicare is going to start negotiating to lower the prices of. And that is going to save people, well, it's going to provide them with better health, but it's also going to save out-of-pocket costs for them and lower the federal deficit.
So we've seen some of this negotiation happen previously with like insulin, for example, and some of these, the cost of these drugs is staggering, especially for some of these cancer drugs. And we'll have a full list up online at channel3000.com. But do you have a sense of dollars and cents wise, how much of an impact this will make on the bottom line for some of our Wisconsin seniors here?
Well, I can tell you that depending on what prescription somebody is on, the out-of-pocket costs can be anywhere, up to tens of thousands of dollars. And, it is out of reach for many. In the process of coming up with the first 10 medications that Medicare is going to negotiate to lower the prices of, I was urging the administration to pick those that are most costly for Wisconsin seniors, but also particular medications that fight cancer that people who have diabetes and other chronic conditions are on, and that will make the biggest difference in the lives of Wisconsin seniors. Now, this won't be the last round. There'll be more medications that will be placed on the list for negotiation as time moves on. But many of the drugs that I urged them to consider, including on that first list of 10, were.
I was going to say, thank you for running through that list. Do you have a sense of where we'll go from here? Any other drugs that might appear on this list? And then do you have a sense of whether this will affect prescription costs for younger people like me, old soul at heart, but people who might not be on Medicare?
So I believe that the results of these negotiations will have a ripple effect throughout all age groups. Obviously, Medicare is predominantly a program for seniors and those with certain chronic conditions or disabilities, and yet there's always a close relationship between what Medicare pays and what the private insurance sector is willing to reimburse. And so I do believe that this will have a ripple impact for others who are not on Medicare.
Senator Tammy Baldwin, thanks so much for joining us. Really appreciate it.
Thank you.
And that was Will Kenneally and U.S. Senator Tammy Baldwin. We will be right back.